Good evening and welcome to Bounce Around Savannah, where positive people are doing positive things. This evening I'm so excited to introduce you to a wonderful man in our community, Dr. Roy Flood, who is a clinical and interventional cardiologist with SouthCoast. But I tell you, that's a mouthful. We often hear the word cardiologist, but I don't think I've ever heard those two descriptions together, clinical and interventional. It kind of seems like you're going to help us before, after, and during our diagnosis.
Well, thank you so much for having me, first of all, Dawn. Let me explain the title. So in the world of medicine, we often think about someone who does primarily research versus clinical medicine, and that's what we think of as the traditional doctor seeing patients, helping patients, office-based, hospital-based, etc. So that's the clinical part. And as far as interventional, I am trained and spend a lot of my time doing what we call interventional cardiology. And what that essentially means is I treat blocked arteries. So if we find a patient that has a blocked artery, we often will place little balloons inside the artery and sometimes tubes called stents that will re-expand the arteries and help improve the blood flow to that area of the heart.
Wow. Now, here's one thing that we often hear about is this term heart disease. And many people don't realize that you're talking about different issues with the heart itself, the valves, everything.
It's a wide and encompassing term that really has lots of little different subsets to it. A lot of times when people think about heart disease, they think about coronary artery disease, the old chest pain, etc. So that's one part of heart disease, and that's essentially coronary artery disease. But hypertension, high blood pressure, is heart disease. Problems with the heart valves, as you alluded to, is a different type of heart disease. There are heart rhythm disorders, and a lot of people will have fluttering or palpitations, and they may have a heart rhythm problem. So that's another area under the umbrella. Problems with circulation to the legs, etc., can also be under the umbrella of cardiology and heart disease. So it's a wide array of things.
You know, medicine and everything has changed so much with the help of technology and new inventions throughout the years. I couldn't imagine how, when you started as a cardiologist, what you could offer a patient and what you can offer them now that could save their lives.
Well, it changes day to day. You know, we have obviously better and different medicines and a much higher range of things we can do with the medicines. But now with the, we're well into the computer and technology age, so we can track patients both while they're in the hospital, at home, while they're on the road, whatever. We have ways of monitoring those patients who need to be monitored. And the things we do on a day-to-day basis, and I alluded to some of that a few minutes ago with the angioplasty and stenting, it's just a whole new world in what we can do from a cardiovascular standpoint.
And even some of the testing that you all do to diagnose this, the scans and the different machines that you use that even 10, 15 years ago weren't even available to us.
CT scans have become a very, very big part of what I do in the management and treatment of coronary artery disease. MRI is now a big part of a cardiologist's choice of tests. Ultrasound is becoming, has been for a while, but we're doing more and more with ultrasound now as well. And then there's the traditional tried and true, the stethoscope. So we have both the old and the new.
Well, make some of our viewers comfortable, because oftentimes when you hear people say they're going for an MRI, they are so nervous, so worried about the test itself, sometimes even more than what the diagnosis might be.
Well, MRI can be a little anxiety-provoking for a lot of patients, because the procedure is often done in a enclosed device or chamber, and that, for a lot of people, that in and of itself makes them very anxious. But it's a quick procedure, it's very safe, and usually the information that one gets from that helps us tremendously in making the right diagnosis. And in certain cases we can use what we call an open MRI, which is not enclosed, so that is better in some scenarios.
Well, stay right there. There's so much more to learn from Dr. Flood. We'll be back in just a moment. Welcome back to Bounce Around Savannah. We're continuing our conversation with Dr. Flood, learning more about heart disease and what we should be looking out for in our own lives from day to day. I think heart disease has long been known as a silent killer. What are some of the things that we should look out for in terms of symptoms that we may overlook sometimes as we go about our day-to-day?
Well, if I may, I want to go back a little bit, because when we're talking about symptoms and diagnosis and treating, I always ask my patients to know a couple of facts about themselves. Blood pressure, weight, cholesterol, and blood sugar if you're a diabetic. If you know those 4 things, you really go a long way in staying ahead of the game in terms of your cardiovascular disease. But on to symptoms now. Heart disease can be tricky to diagnose. A lot of the things that happen in the heart attack patient can also be caused by other things. For instance, chest pain or heartburn may not always be heartburn from something that you've eaten. It may be cardiac in nature. I often tell my patients to describe for me what they are doing when they get heartburn, or how long the heartburn lasts, or does anything go along with the heartburn. All those things are telltale signs that could help us distinguish between the two. For instance, if you get heartburn every time you're walking up a hill, but you're not eating anything, that may not be heartburn. And a lot of times people either are not aware of that or don't really want to acknowledge the fact that something else might be going on. So we're there to help sort it out.
So what can we do in terms of prevention? We know we should eat better, we should exercise, but I need that to come from you. So maybe you can get all of us moving so we can live a longer, healthier life.
You know, again, it's one of those things that's easier said than done. We all know what we should eat, but I try to give people something concrete to hang their hats on. And one thing I think is a good starting point is looking to exercise, aerobic exercise, walking, jogging, something that gets the heart rate up, a minimum of 30 minutes a day, at least 4 to 5 days a week. More is fine, but let's start with that baseline and go up from there. So that's number one. Why are you looking at me like that?
I'm just, you know.
Okay, so
just
that's
taking my
number one.
notes here.
And then it's very difficult, particularly when you live in a city that has such great food like Savannah, but we have to make sure that we switch our diet so that we're really incorporating a primarily plant-based, low-fat, low-carbohydrate diet. I'm not a believer in no meats, although meat does have, certain meats have high fat contents, etc. But I don't think that's a mandatory part of a better diet. But keeping meat consumption to a minimum and really focusing on the fruits and vegetables will go a long way towards helping heart-wise.
In recent years, we've heard about the large number of women now who are suffering from heart disease, and the symptoms may even be a little different than what are traditional symptoms for men.
Now you open up a Pandora's box. But you're absolutely right. Women do have atypical presentations a lot of times. Now, not always. They still can have the classics, center chest pain, etc. But there can be things as wide-ranging as neck pain, just a little bit of fatigue that they don't normally have, left arm tingling, numbness with activity. Those all can be signs of heart problems. Women often will present with nausea or abdominal pain with certain activities. So those are things that will make me hearken and pay close attention if someone says that they're having those problems.
And if, say, for instance, we were here and someone started presenting some of those symptoms you just talked about, it's always important for us to call 911 right away, of course.
Always.
But what can we do to comfort that person or help their chances as we're waiting for help to arrive?
Well, help to keep them calm. Assist with anything you have at home that might allow you to take blood pressure or check their heart rate, etc. If they're sweaty, keep them cool, a nice cool compress, those sorts of things. Have an aspirin available. And definitely if they're having problems with breathing or chest discomfort, giving them an aspirin tablet is often very, very useful. And then getting help as soon as you can.
Okay, anything else you want to add, sir?
No, it's a pleasure to be here.
Thank you so much for being here. We appreciate it.
Thank you.
Hope we have you back very soon.
Happy to do so.
We'll be back in just a moment.